If you're looking forward to getting the new year off to a good start, why not first focus on your heart health? There are many reasons you should keep your heart at the top of your priority list. Keeping your cardiovascular system as fit as possible can, of course, reduce your risk of heart attack and stroke. But that's not all having a healthy heart can do for you. If you're in good cardio shape, you're also achieving better balance, reducing your risk of falls in your later years and extending your life expectancy. When it comes to the heart, believe it or not, women are very different from their male counterparts. So much so that it inspired Dr. Nitza Alvarez at Tri-County Heart Institute to write a book about the subject. She sat down with us to talk about the differences between men and women and why she wrote her book, Heels versus Ties.
It wasn't until 2016 that the American Heart Association released the first statement recognizing, after 93 years of the history of the association, that heart disease is under-recognized in women, presenting in a way positive the need for more studies to understand why are we different and the differences in treatment. Did you know that over 8 million women live with heart disease, and for every woman that died from breast cancer, 6 die from cardiovascular disease? More women die from cardiovascular disease than all the cancers combined. 420,000 women die yearly from cardiovascular disease, and 50,000 more women than men die yearly. And did you know that that discrepancy in death is because coronary artery disease is underdiagnosed, undertreated, and under-recognized on women? This book is written for you, those that live with their number one life threat in silence, those that will die because they don't recognize the symptoms that they're having are because of cardiovascular disease. When a person is experiencing chest pain, jaw pain, arm pain, they think about heart disease. And although a woman can present with those symptoms, more often than not, a woman that is suffering from a heart attack will not present with chest pain. They're gonna present what is called atypical symptoms. Atypical symptoms, I think it's time that we get rid of that term, because it's atypical only because men will not present with those symptoms, but is how typically a woman will present. Those symptoms are shortness of breath. A woman that is more short of breath than usual doing her regular activities, a woman that is short of breath at rest, a woman that is experiencing more fatigue than usual, pain in between your shoulder blades in your upper back, a pain that you cannot explain, feeling queasy or sick to your stomach, discomfort in the epigastric region, which is just that mid portion in the upper abdomen. Those will be the typical presentation, typical symptoms that a woman will present with when they're having a heart attack. The symptoms can be very subtle and can present a confusing picture when you're trying to seek medical attention. This book is going to give you the tools to be able to recognize symptoms related to coronary artery disease. What are your risk factors? When to seek medical attention? What tests you deserve to have done? And what care you deserve. As a cardiovascular disease specialist, as a woman, a daughter, a sister, a mom, these statistics upset me. And this is the reason why I decided to write a book to create awareness of why are we different, to create awareness for those women that are out there perhaps suffering from symptoms related to cardiovascular disease and not knowing it, to empower you, to educate you, to give you the tools that you need to understand your body and be your own advocate.
You can meet Dr. Alvarez in person during her heart health presentation and book signing at the Fruitland Park Library on February 5th from 4 p.m. to 5:30 p.m. or at the New Venetian Center in Leesburg on Thursday, February 20th at 6 p.m. For more information and to RSVP to the February 20th event, visit tc-heart.com/events. We also caught up with Dr. Alvarez as she moved her weekly Walk with a Doc to the Leesburg Regional Medical Center Foundation's Mistletoe Trot 5K earlier in December. A fundraiser for the LRMC Foundation, Tri-County Heart Institute sponsored one of the water stations, while Dr. Alvarez and a few of her patients enjoyed a leisurely walk around Silver Lake.
This is a perfect opportunity to emphasize the holiday season. There is never no time for exercise. I think that during the holiday season, we tend to focus a lot on food and entertainment, and although that is wonderful and is part of it, I think that there's always room for making the good choices, and what better time to go out for a walk with your friends.
You'll find information on the book signing, Walk with a Doc, and the Tri-County Heart Institute when you click the At the Heart of It story link icon on our homepage at yourhometownhealth.com.